Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408-687-1899 and email address homeomedicine@yahoo.com. Anytime when you are tired of any disease at any age, and you want to take second opinion of your disease, or if your treatment is not progressing, you are not getting any benefit from the present treatment, please call me to discuss what are the hurdles in your cure, what are the problems for your treatments. I can guide you according to the natural way, how the nature was curing. When there was no medical science, even then people were suffering from the diseases and people were being cured from the diseases with the natural processes, the natural immunity which was provided by the nature itself. And since the life created, since then it has some immunity came from the parents. So ultimately, with his own diet, with his own exercise, the human beings create their own immunity, and then ultimately life goes on and protect himself from the diseases. In this way, there is a proper channel of the nature, and now the medical science has gone through that channel. Medical science has learned about how the nature was curing the sick persons or curing the diseases. In this way, we have learned from those knowledges, those past indications that the nature has given us. Same way, in case if you are tired of any treatments and your treatment is not progressing, I can guide you. I can guide you and I can walk through it with you with the natural processes for your disease, because every disease has its own course. Every disease has its own progress, different type of progress, so that I can guide you. What will be the outcome, what should be the outcome, and how it should proceed towards cure. In this way, I can guide you about that one. So please, if ever you have any type of health problem, any type of health issues, call me at 408-687-1899, and I will appreciate your call and will guide you properly to the best of my judgment and based on my 52 years of experience in medical science. So I'm discussing all these things regularly regarding the journey of the sperm or the journey of the life, and the whole life was created, and we are reached up to the content of that. If a person falls sick, if a body falls sick, what type of outwardly indication it expresses, so that before going inside, because the inside going means pathological investigations. Inside going means we know what are the damages occurred inside the organ, inside this body or in the systems. But before going to go inside the body through lab test, x-ray, and other various devices we have created nowadays, there are always some signs which indicates any change inside the body, in any system or in any organs. So it's a must that everybody who is basically is a medical practitioner, who is a healer of the sick persons, must know all those things. And not only the physician should know this one, not only The healer practitioners should know this one. Every individual person should know this one, because these are the preliminary sign and symptoms which are produced when the disease influences acts on our vitality, and disease influences cry for help. And what type of help it needs, it indicates through the symptoms. Just like after eating anything, a person is having vomiting, nauseatic tendency. What does it indicate? The nature or the inside of the body is indicating that there are some types of substance has gone inside the body, and that substance has is you can say uh, is not acceptable the systems, and the nature want to expel it out. And when I was talking about this thing, that whenever you have nauseatic tendency, whenever you have vertigo, whenever you have any tiredness, whenever you have any type of sign on your skin, all these signs are indicating to you that what type of changes inside the body has gone taken place, and in what organ specially or what system these changes are related to. And then you can go directly to the functioning of that system, and you can go directly to the abnormalities of the system, and you can find out the ways to relieve that one, to eradicate those causes in that system or in that organ easily, because you directly know that. You directly know that these are the sign and symptoms, and these are sign and symptoms produced by a special type of system inside the body or a special organ inside the body, so that directly you can go to that. In this way, for example, if just like just now I told you about the nausea or vomiting. Nature wants to produce vomiting. Nature wants to produce and nausea, so that something should come up, which has gone inside the body and which is not acceptable by the systems. And when I was talking about these things, I told you about these two things here: the substances which are not acceptable to the body, and the body wants to expel it out. Nausea or vomiting is the indication of that. But this substance which is inside the system may have gone from outside, or even it may have been produced by any other organs inside the body. That is why we created two terms. One is endotoxin, the other one is exotoxin. So, if from outside with our food or a drink, anything has gone inside our body, this is known as, and that produces the sickness, that produces the six symptoms, is known as exotoxins. So, whatever has gone inside the body from outside by any means, by drinking, by food, by whatever, that is called exotoxins. But if that kind of condition has been produced by the system, by any organ of any system, and that thing is circulating inside the system, inside the body, which is not acceptable, which is not acceptable, and when in circulation it goes to the digestive system, it has a mechanism, it has a mechanism, so that with that mechanism it can expel this toxin out from the body. And on the initial stage, we have to find it out. We have to find it out whether the disease producing causes are internal or external. And in that way, you have to avoid those gases as far as possible. As far as possible means if it's dietary errors, if it's a drinking problems, then ultimately you can change that. You can stop taking those type of foods, and then in a due course, that nausea or vomiting will be relieved. But suppose a person is having any kidney problem, a person is having any problem in the excess of urea or uric acid or whatever, that is produced internally and has not been separated by the kidneys. It's circulating in the skin, it's going to the system, digestive system, and ultimately that digestive system feels whatever has come up, nitrogenous substances, toxic substances. It was produced. For example, just we give the example of the kidney. So this toxin has been produced by liver, by kidney, by any other organs, and that is circulating inside the system. And then whenever it goes to any source, suppose if it goes to the urination, automatically the nature of the urination will change. Frequency of the urination will change. If it goes to the digestive system, definitely definitely we will be having that kind of condition created by our vitality, that whatever substance has come up from outside or from inside, it is not acceptable. And it is not acceptable, that is why it should be thrown out from the body, and that gives type of indications, and from where we can judge that something has wrong gone inside the body, or something has present inside the body which is not acceptable. And internal or external, internal toxin produced by various organs are not easily corrected, not easily resolved, because these are concerned or attached with the sickness of a particular type of organs. And unless that organ is being taken care of, this will not go. This will not go. It means to relieve these kind of symptoms, we need to go to the root cause and relieve and cure that organs. And it is not that immediately that has produced the symptom, vomiting or nausea, as a endotoxins. No, there were symptoms and must be indications before it reaches to this extent that the body wants to expel it out by the vomiting. So inside the body, there are various other signs we can find it out by close observation of the sick person's sign and symptoms. Sign means he indicates. Suppose if a person is having headache, he will touch his forehead, he will press his head. What it indicates? It indicates that he is having pain in the head. Why this pain is in the head? There will be reasons. And that reason will be the toxins, toxin of food, toxin of environment, toxin of heat, sun heat, or anything, or it may be the internet. So in this way, first of all the signs and symptoms which are produced by the by our body or systems, then it indicates that, sorry, one thing. Yes. It indicates that some type of substance or toxin has entered, is circulating inside the body, which is not acceptable. So relatively, us, the thing is that how we can resolve this one, how we can excrete them, how we can, you can say, filter it from the blood circulation, from all the systems. Normally, there are routes: stool, urine, sweating, breathing. All these things are the way by which we can excrete all these those toxins. But Unless you stop that production of that type of toxins, it will not go forever. Ultimately, you have to find it out whether it is endotoxin or exotoxins. And the endotoxin, I told you about that one. Exo, you can find it out from the behavior, from the eating, from the drinking habits, and all that. But endotoxins, you have to find it out from the survey of the whole body, that what type of symptoms he was having previously. What of the symptoms mean were indicating a particular type of organ or system was sick. So it takes a little longer time. Whereas the external toxins which are causing these type of vomiting, just like you eat food, a type of food that, or you have overeating, and ultimately you have nausea or vomiting. And if we know that, oh, it is because of four parathas you eat, so in this way we will restrict him, or he himself avoid him, not to eat more parathas, not to eat this kind of foods which can cause vomitings and all these things. So in this way, external things are easy to identify, and also easy to distract the body from those substances. If we know them, it is always we have a chance to remove those toxins, those causes from the body, and in this way, body will be cured. And even timely fashion. Sometimes what happens, just like I give you the example of paratha, heavy food, heavy fatty foods, fried foods, and ultimately we know that there is a specific time for for these things to be dissolved, these things to be digested by the system, and all the components will go into different places in the food. So in this way, ultimately, external toxins which are causing some type of symptoms, abnormal symptoms which are not acceptable by the body, will go off himself after a short while. Suppose if provided you are not giving the same type of food to the body, and you are aware of the things that what these are the things causing problems for the body, so we have to remove those things from our diet, or we have to obstruct. So then it's very easy to resolve the issue of the external toxins, but it's very difficult to resolve the issue when the toxins are internal. Means disease producing causes relatively, because our vital force our vital force is not visible, invisible. That is why we consider this vital force as vital force. Forces, powers cannot be seen. Powers could be realized by their working on the physical body. When they act on the physical body, whatever the machines, bulbs, everything, that starts working. It indicates that there was power. That is why the substances which we add in the systems, they are because we have a living force inside the body, and it is his response against the substances eaten, drunk, or somehow entered into the body. Even the smell. Sometimes you might have seen that people smell something and become unconscious. Just like many times I give you the examples of this one, that a term which is very prevalent. Everybody knows about allergy. Whenever you fall sick, most of the times you go to the doctor and doctor will tell you it's allergy. And ultimately, we analyze this type of terms of allergy, and we find there are many types of allergy, and most probably known as the skin allergy. But it's not only that the skin is only allergic and skin is the only which manifests symptoms of sickness. No, there are various other organs. Just like the allergy may be a respiratory allergy, and the lungs will produce, or the system of respiration may produce some of the problems, allergic type of things, behavior, and our respiration route, our respiration response will be changed, and it will create more problem for our vitality to run. So that's why we can say that it's a vital force or energy. So energy of the substances which are not acceptable to the vital force, they produce their symptoms on the physical body, because previously the physical body was under control of that vital force, and now it has been influenced by the external forces, just like you can say mosquitoes. After a mosquito bite, someone suffers from malaria, but it is the toxin, or it is the reaction produced by malarial parasite and added to the blood, and blood is responding in a specific way when a particular type of bacteria or virus or parasite attacks on our body. But it is not the organism. Basically, if you see deep, suppose if dead organs, even the honeybee or any other type of insects, if they cut you, they are in living persons. But if you take some dead particles or dead type of animals, just like mosquito, just like a honeybee or all that, if they are dead, they will not act on your body, because the power which was supposed to act on our body has gone. Then, if in the living history any honeybee or any other insect is biting to the body, it is its progress, or you can say the property of the vital force of that substance, or honeybee or malarial parasite and all that, that they are influencing our vital force. Many times in these lectures I have given you the history that if a person says mix the salt into the air, it looks foolish question. How air could be absorb the salt? How the salt will be you can say mix up in the air? But when you check the ammonia gas, you will see that there is ammonia smell. Sulfuric acid, if you smell this sulfuric acid, it will show you the similar type of characteristics. What does it mean? It means that it is producing similar type of reaction only because there is vital force. There is power in it, which individualizes this substance individual from the other similar type of substances. There are many more insects. There are many more insects, and every bite of every insect has different type of influence on our body. And it is not that insects, it is their influence, it is their power. Because I just told you, if you cannot mix the salt into air, it looks a foolish question. The same way, it's a foolish question that the malarial parasite is affecting our vitality. Malarial parasite is acting on our body, but the influence of his toxin is changing the vitality, is changing that power which is responsible for the for this healthy body, for the body, so that it remain healthy in this way. So there's a little difference must understand and this thing, that it is not the malaria. Sorry, it is not the malarial parasite. It is the influence of that one. Suppose if a malarial parasite will bite any dead body, do you think he will be having malaria? No. And if a person, a malarial parasite is biting to the human beings and they suffer from malarial type of symptoms, then it indicates that there was vital force, there was some influence, and also there is an influence of that mosquito or that of insect which is affecting the vital principle, because it's the vital principle, it's not the body, it's a vital principle which is responsible for all normal and abnormal functioning of this body. It means if it is producing some different kind of symptoms which are not in normal stages, then it indicates that body was constructed in a way that it can run solely on a normal ways. But if anything stronger than this one comes to the systems and the system is changed with his behavior, then ultimately that behavior reaches to our behavior. Means invisible powers are mixed with the invisible powers, and in this invisible power you can well imagine invisible power, you can well imagine that power affects the power. Suppose a simple example, just try to understand. If a person is impressed by another person, he is not touching his body. If a person is influenced by another person, what it indicates? It's power, invisible power. His personality's influence and this physical expression, it will not affect any dead body. It will affect only the living human beings. And living human beings, when we say, it means there is something alive, or there is something which makes this body alive. Prove this body alive, that this body is alive. It's not dead body. So in this way, in this type of things, many of the things are affecting, we see on the physical body, but relative actually they are not affecting the human body. Human body affecting means just they are pierced by that, and that you feel pain only. That's and after that, their side effects are producing in a different kind of fevers, different kind of reactions of the skin, and all that. So all this is only possible if there is vital force inside our body. Me and vital force, I declared it is a power. If it's a power, it is only affected by the powers. And if it is affected, it means whosoever is responsible for producing these type of sick person, sick symptoms, is a influence. Is not a mosquito. It is the influence of mosquitoes property, and that is after the mosquito bite a person. So in this way, I can perhaps I'm able to let you know that body is only living body if the living body means the vital force is prevailing inside this body, and that is a power type of, and that is invisible type of. So in this way, if a person is producing externally any type of substance, is producing any difficult type of symptoms which are considered as a disease. Hurried breathing is not a simple life, it's a difficult life. Overeating is not a difficult life, it's overeating. In this way, many other actions are learned that they are not particularly normally, but they are because of the influence of any type of specific intent. So, in this way, I can tell you that every response of internal or external influences produced by any substance or produced by any living organism like mosquito and any other things is responsible to effect our vital force. Because I just told you, if the vital force is not there, means person is dead. The mosquito will not produce malaria. Mosquito produces malaria only when the persons are living. And only persons are living, but many times we have mosquito bite, but we do not suffer from the malaria because of the immunity. So in this way, we can figure it out. The toxin, disease producing power, is produced by any type of internal toxin, internal substances released from any organ, or is from outside and has gone inside by drinking, by eating any type of food substances. So this thing will happen. After that, a living organisms always is reactive. It is always reactive. Whatever response, suppose if you say something, bad words to anybody, he responds. He responds by expression. He responds by voice. He responds by violence. That is the response. Suppose if a person is deaf and dumb and blind, and you are abusing him, what does it mean? It has no effect. When it was having effect, when he was having senses intact. So senses intact means they are the tools of vital force to express himself. Our senses are the tools of vital force which expresses himself through these vital organs: eyes, ear, nose, throat. The vital force indicates himself that this is the thing. And now you need to influence. You need to influence, or in other words, you need to overpower this outwardly. It was not always. Outwardly, impression, influence of that substance which was causing problems or which was producing disease. In other words, which were not allowing our body to run normally, just like it was in health. When a body is in health, it breathes normally, it sees normally, it hears normally, and all the other emotions and all the other senses are working normally as is it desires. But but if the person is sick, means person is under influence of any other power which is stronger than our vital force, and our vital force is forced to run according to him, that external influences or the external influences, whatever it is. Our vital force is bound to or forced to run according to his advices. For example, normally the blood pressure we count is 120 by 80. Something has happened externally or internally. Externally, I told you, by the food, by the environment, by whatever, it can influence the internal things. But internally, if any organ is damaged and is producing some type of toxin which are not acceptable by the vital force, and it goes circulate throughout the systems with various organs, and all the organs are responding to that. All the organs are responding to that, but all the organs are weaker than that influence. When they are weaker than that influence, it means they are bound to work according to that influence. They are bound to work according to the outwardly influences, maybe internal or maybe external influence. In this way, our body will produce symptoms other than normal. Other than normal means blood pressure will not remain 120/80. Blood sugar will not remain 180 milligrams of per 100 ml of blood. In this way, all the norms of health, we have a standard of health, we have some symptoms of health, and all those symptoms, when a person is not feeling anything, just like I'm breathing, I don't feel anything. It's going on normally. But if something happens internally or externally with my respiratory systems, and I feel difficulty in normal breathing, it hurts. In this way, when any type of symptoms, the disease symptoms, are produced by our vital force, it indicates that the influence of external or internal substances was stronger than our vital force. It was stronger than our vital force. That is why our vital force is bound to work according to him. Suppose a country, a president of any country is overpowered by any other emperor of other countries. Schools will remain same, police station will remain same, post office will remain same. Means all the institutions, every institution which is running in a nation will run when it runs normally. That is known as health. Oh, everything is going normally. But when anything or everything is changed in their pattern or working, it indicates that our vital force, which was responsible for this body, the normal or abnormal functionings, that influence was stronger than our vital force. And if it's stronger than our vital force, it means it is bounded to work according to the outwardly expressions, whatever it may be. Whatever it may be, it is bounded to work according to the outwardly influence on our vital force. And now, under these conditions, if you want to cure that person, what you have to do? Any person, any sick person, first thing with any sick person is to understand that this body or the vital powers working inside this body, so that this body is a living body, is under influence. If it's not normal, if all these systems are not working normally, and somehow you feel problem in any of these systems, sleep, dream, desire, aversions, eating, barking in any condition, if you do not feel normal, it means you are under influence of some other toxin agencies. And those agencies may be internal or external. And the first foremost thing is that you should recognize what are those toxins, from where they are entering into our body, into the body of the sick persons. Is it directly from the body, outside the body, or is it from inside the body? So in that way, we have to, if we want to correct that one, the first and foremost thing is to understand the source of influence, source of disease producing influence, from where it has come, and then try to remove that one. And I told you, if it is internal, then ultimately you have to find out the sources or ways so that the organ which is sick and producing internal toxin relatively again furthermore, just like we see the complication of the disease. Normal complication means a disease is going on, passing its normal course, but something happened seriously, and the symptoms of normal routine has increased to the upper level more, and then this is overpowered. So in this way, when a person is sick, so first thing you should recognize that a person is sick because its vital force is overpowered by some other influences, and which are carried out internally or internally. So first thing you have to recognize this one. Then after that, if it's external, I told you, try to find it out, try to vacate the things from that artificial means. And then the third one, I already told you about the when it is internal, first and foremost duty is to understand that what organ is producing the toxin, then to treat that organs. And when that organ will be treated, ultimately person will become normal. Otherwise, if that organ is not cured, is not find it out, and you are unable to remove all the toxin produced by that organs, then the condition will continue to run in this way, and you will not be able to cure the persons, because you are unable to relieve all those causes which are creating problems. So, so in this way, what we resolved today. First thing, a sick a person is a living animal which has all the senses intact. Through the senses intact, it shows itself that I am healthy, and we have a standard of health which we understand that these are the normal signs of health. Respiration hai, blood pressure hai, pulse rate hai, and many other things. There are standards of the health. So all those signs and symptoms which we see are not normal, it means it is under influence of some type of toxin substances, some type of disease producing powers, and those power is resulting into the history of the patients in front of you. And to get rid of all these things, you need to know that these toxins were an internal or external. And then we will wake up, and we will try the treatment for those things which are internal or which are external. External, mostly we have to just protect them in eating. We have to protect their exposure to the living body. Whereas the internal damages, and to relieve those one, it indicates that the immunity was weak, and then now you have to give something so that the internal organ which is producing more toxin. So garbage is produced by every organ. Garbage is produced by every organ, but there are some organs which has affinity to produce toxin, and their toxins are used by the other organs, or they are responsible for the overaction of the body. And if that overpowering of the body is not under your control, then under those conditions, this disease will run. This disease will run, and you will not be able to relieve that. So, remove the causative factor, internal or external. Internal causative factor, you have to find it out. What organ is producing that type of toxins to make this person sick? And then until that organ or the system will become healthy, the person will not be considered as cured. It will be only if we find out the sources or the causes of producing the disease, and that we have relieved that. It means we have made these vital forces stronger than that, and then that stronger vital force has already cured that kind of patients. So I think it's easy to understand. So we were discussing about the journey of the a person, and we have discussed today the sick person, how a person falls sick, what it indicates. Question was what it indicates. It indicates the immunity is weak. It indicates the internal systems are not working normally. It indicates the immunity or the internal system or the functioning of the body is weaker than the influence which is producing disease, which is making it sick. So, under those conditions, we have to find out the first foremost causes of any disease. And if you find out the causes of any disease, then and only then, if you treat them, will be successfully, you will be able to treat that, because you know what are the reasons, causes behind this disease, and you are able to relieve or remove those causes from the systems. Then and only then this is possible. But if you do not find the causes, means diagnosis, if you do not find the causes, internal or external, you will not be able to treat that or eradicate that. When we do not know about the enemy, then how we can fight with them, or how we can win them? No, not at all. So disease producing causes and the responsibility, all these is a visible power type of things which is beyond the limit of organs. And then they are the actually power or the vital power which is responsible for all healthy or unhealthy health, or in sickness, unhealthy behavior, symptoms of anybody. It's a healthy or unhealthy behavior of a body is a disease. And that is only because any other stronger influence is fighting and overpowering the influence of this our living body inside. And then that living living influence inside our body is bound to work according to the new influences. That's also vital force. That's also influence of some other thing, of malaria, of any insects, or whatever it is. It is their influence which is overpowering our influence in the health and deranged the health of that. So in this way, when we are going to treat all that, we need to find out the causes. And if we find out the causes, just you can think that 50% of work is done. When we do not know about the causes, then it's very difficult to cure. Yes, temporarily you can give some relief. Nowadays, medical science is only depending upon to relieve temporarily, to give some soothing effect temporarily. And that is why every patient, for every type of sickness, is going to the doctors time and again with the similar symptoms, because we are adopting the fashion of treatment temporary relief. Once it should go. Once the patient should say, "Oh, doctor, you have done a wonderful job. You have given me this medication or you have given me this injections, and since then I'm okay." But again, after some time, after a few days, after a few weeks, he will again come to you with the similar symptoms. And in spite you, he himself will tell you, "Doctor, last time I was sick and you gave me this injections or this capsules and this tablets. I took that one and I was okay. And I was okay for a week, for a 2 weeks, for whatever it is." And ultimately, he will fall sick again, because he was looking immediate effect. You were also following the instruction of the sick persons, because sick person wants to be cured or needs health immediately. And that immediately does not mean that you will suppress. That is not considered as cure. It is considered as suppression. Cure and suppression, these are two different things. Suppressions temporarily cease fire. Temporarily cease fire, that a particular type of toxin which was influencing our vital force and bounding our vital force to work abnormally, not in its routine or normal fashions, in a different way, which is considered disease or sickness. And ultimately, for sometimes, we have suspended the power or we have activated our vital force, just like you are having headache. And headache is because of some tumor inside the brain. You give some painkiller medications, it is relieved. It is relieved, but after some times, unless that tumor has been removed, unless that high blood pressure has been cured, unless any other reason which was causing the headache or which was producing the tumor inside the brain has been cured, the person will suffer time and again with the similar symptoms, because we are in the nature of suppressing the painful symptoms, not curing the painful symptoms. And if we are suppressing the painful symptoms, it indicates that we have not gone behind the causes. We did not find it out, the causes behind the disease, and those causes were suppressed and ceasefire. A type of condition was prevailing which is called ceasefire. Temporarily you feel better, but ultimately that ceasefire is not lasting longer. Again, the same thing happens. Then it says, no, the treatment was not good. Basically, this was not a treatment. Treatment has two things necessary. One is the management, the other is the proper treatment and relieving of the causative factors permanently. So, these two things must be there if we want to cure the persons. That first of all, management. If a person is in pain, immediately. Yes, you can do anything to relieve his pain, but that's not a treatment. That's a part of management. And anything which you do just to relieve temporarily, that indicates that you have not gone after the causative factors. You have not learned about the causative factors. And if you have not learned about the causative factor, how we can assume that you will cure them, you will eradicate them, you will wash them? No. So the first part of in for the treatment of any sick persons, you have to relieve, you have to give immediately relief to the patient. If he is suffering with a severe pain or severe type of conditions, he should be calm and quiet. And after that, your work is not over. It's not done yet. Unless you find out the causes of this type of influences which was producing this disease. Any causes which was responsible for the sickness, this kind of sickness. Unless you find out those causes and unless you relieve them from the history of that patient, the disease will not be cured. Disease will not be cured. Even after that, some question remains. People's, after following these directions, first of all, relieve temporarily if it is desires. If the person is in severe pain, relieve it. But that is not a treatment, but you have to relieve the patients. Second, you have to go after the causes. Okay, what are the causes which have produced the disease? And then you should find out how to relieve those causes. And you relieve, you know that the causes, and you now know about the how to relieve those causes. And then suppose a person is suffering from malaria, and you know that, and ultimately you can clear the environment wherever he's living, wherever he's working, wherever he's sleeping. This type of things should be relieved, that there should not be any malarial parasite or malaria over there, means you know the causative factor behind a disease and you have relieved that. But one thing, the third one, is the third principle for the cure, that this living body has its own routine to cure the sick diseases, sick persons, or the sick tissues, you can say basically. Every tissue which is hurt, every tissue which is affected by the outwardly or inwardly toxins or influences to produce the disease, and you know that, and you have relieved those things, even then you need to keep patience. Why? You have suppose you were having gas, and you know that this gas is because of overeating, and then that overeating will be relieved after 5, 6, 8 hours. Ultimately you should be healthy. Same way, you are having any diagnostic problem, and then you know the causes, and you relieve the causes, all those causes, and you tell the precautions to the patients, and patient continue with those precautions, mean the causative factor of the disease has been removed. Causative factor of the disease, if it has been removed, it means still there is a time, because living body has its own routine to repair, has its own time to repair the damaged tissue. There are different kinds of tissue, just like the epithelial tissue, or you can see that bone tissue, muscular tissue, nervous tissue, different kind of tissues. And all the tissue are having their specific time period to reverse. If they are sick, reverse means to become healthy. Whatever their damages is, they are having their own specific time to be cured, to come to the normal. In this way, even after finding out the causative factor, even after relieving all those causative factors, even then you have to wait till the treatment, till the cure is completed, because every tissue has its own course. You know the bone is broken, you apply the plaster, yes, it's okay. But ultimately, whatever is required for the joint to form normally, fractured bone to repair normally, that has been applied, but even then it has to take time, and you have to wait for that. But all these things, before going to this treatment, the first thing is that every organ, when it falls sick, it indicates by the external signs and symptoms to the individuals or the doctors, so that they can know that what type of system or organ is damaged, and what is the quality and concentration of that sickness, how long it will take, and how it will be cured. All these things. But first thing, to know the toxins. Second thing, to whether it is external or internal toxins. Then to relieve the causative factor of that toxin. Or causative factor means whatever the organ is producing, if it's inside, to cure that one. So this is what we have to do that one. Our next lecture will be perhaps in Punjabi. And in Punjabi lecture, I will describe you what are those signs and symptoms. If you go to see a relative, if you go to see as a doctor, you are going to see a patient, what type of external sign you will see, and you can assume or presume that this person is suffering from this type of disease. This person is suffering from this type of disease, and how we can relieve those things. Then how long we have to wait for the persons to be cured fully, because we know the time period of the tissues which are damaged. So this is what I will tell you on my next lecture in Punjabi, that what signs and symptoms you will see, that how you can declare that how long it will take if it is not complicated. If it is complicated, I don't know how long it will take, but if it's not complicated, it's a normal routine, then ultimately for each and every tissue, there is a time period of repair. And then, even with the correct treatment, even with the correct management, even then time is required, because it is the time every tissue needs for its repair. God bless you all. I am your host, Gurdeep Singh Sandhu, homeopathy consultant. My phone number is 408 687 1899. Email address homeomedicine at yahoo.com. Anytime, if you are suffering from any disease at any age, please call me for your second opinion. Or if you want to be treated with a scientific approach of homeopathic and Ayurvedic medicines for your sickness, yes, please call me at 408 687 1899. And if you think these lectures are beneficial to you and you are learning many things in these lectures, please convey this message to your nearest and dearest, so that they can also join my Facebook, they can also join my YouTube channel, or they can listen Sabrang Station every day from 5 to 6 California Pacific Standard Time, so that they can join us and they can listen everyday lecture on health issues, the journey of the life, or the journey of the sperms, and how this body is developing, and how this body is falling sick, and how we can cure this thing. God bless you all. We'll see you tomorrow. Remember, phone number for any consultations. There is no fee for the consultation, please. You can call me 408 687 1899. Sat Shri Akal, Adab, Namaskar.